to everyone. Okay, good. Hello, everyone, and good afternoon, everyone here in Europe. And hello to Dr. Sara Khorram from Karachi, Pakistan. We do have today we have a very wonderful guest with us. Sara, she has built up one of the most prominent telemedicine platforms in Pakistan. And Sara has also a very, very personal story behind her platform. Sara herself is by training a doctor. She will tell us about the phenomenon Doctor's Bride in Pakistan. Sara herself is also a mother of 2 girls and today one of the most powerful and successful women in digital business I would say in the whole world, in telemedicine for sure. Sara, I would say the floor is yours. And for everyone else, if you have questions, don't hesitate. Put it in the chat and we will address the questions afterwards. Sara, the floor is yours.
Hello, everyone. Good evening, as it is evening at my time, and Assalamu alaikum. My name is Dr. Sara Said Khurram. I'm from Karachi, Pakistan, which is in Southeast Asia. I feel very empowered and very advanced today in trying this new method in which I directly come in front of the presentation. So thank you, Petra, for introducing me to this new method of presenting. I think my story starts when I was around 5 years old. So I belong to a very traditional middle class family in Pakistan. My mother was a homemaker. My dad was in police. They weren't educated beyond bachelor's level. My parents were those sort of parents who put away money for their children's education, as all middle class parents do. When I was growing up, I was youngest of 2 elder brothers. So as far as I remember my childhood, my father always said that you have to become a doctor. I was never given another career choice in my childhood. So all my years, starting when I was 5 years old, was to prepare to get entry into a medical college. And I thought that, all girls who come from educated families enter into medicine. And then I was put in a school that was in preparation of medicine. So I saw all girls studying for the same thing. When I entered into my medical college in 2005, I saw that out of 300 students that were in my class in a huge hall in my medical college, 90% were women. And during my conversations, I realized that they all have been fed the same dream that they had to become a doctor. And that is when it was the first time that I learned that why my parents and all their parents wanted them to get into medicine. So Pakistan has something which is the doctor bride phenomena, which means that parents want their daughters in Pakistan to become doctors, not because they want them to serve the community or help people, but it gets you a better hand in marriage. So if you're a doctor in Pakistan, if you are on top of that tall, fair and thin, you get the best hand in marriage because everyone wants to wed a doctor and everyone wants a doctor, daughter-in-law in their family. It's a moment of prestige for the son's parents or the son's mother. So we saw that, when we were transitioning through the 5 years of medical college, we saw that a lot of women who had come into medical college with high dreams and were taking positions and coming first in their class started getting married and having children. So much so that I remember that my final practical exam, it's a OSCE, so you have to run from one station to another and identify subjects. So the girl in front of me was 8 months pregnant and the girl behind me was 4 months pregnant. And that happened to me as well. So 3 months after my graduation, my parents wed me off because they wanted me to get married to the eligible bachelor, and that came eventually. When I got married, I started studying for my post-graduation. So my husband allowed me to work. It wasn't that he was against it. So he allowed me to work. But I got pregnant 2 years after my marriage. And at that time, I was doing my second year of post-graduation or my residency. in radiology. And in radiology, if you're pregnant, you can't continue for 2 years because there are radiations to the baby and then you're breastfeeding. So I was put off from the program. I was told to quit nicely. So while I was pregnant and I didn't have anything to do and I couldn't sit at home, I joined a community clinic in my city, Karachi. It was in an urban slum where there was no female doctor available. And I used to go to the clinic, see patients, and my time was passed and I thought I was doing something for the community and I really loved it. I also realized that, as we were talking earlier, that there are so many issues at community level that go ignored. And that's why more patients turn up into tertiary care hospitals or big hospitals with diseases that could have been solved at a primary healthcare level. But my being there, telling them those early signs was really helpful to them, especially for the women and children. After my delivery of my first daughter, who just passed behind me, we shifted to a new city. So my husband got promoted, we shifted to a new city. And so I went into a big house in a new city with a newborn daughter and suddenly realized that now I had actually become that doctor bride because I was at home, I couldn't work, I couldn't leave my daughter back and I couldn't continue with my career and then there didn't seem a way out of it. So I went into postpartum depression. And in that time, when I was struggling with postpartum depression, my nurse from my clinic in Karachi, she called me and she said that patients are coming to the clinic, but I can't find another female doctor. And what should I do? So I started seeing patients on call from my house in Lahore, which is another city, to the clinic, which is in Karachi, which is another city. And later on, we converted into video calls because I had to see the patient, I had to see their eyes, I had to see the lesions. So we converted into video call. And doing that, I realized that if I, being a doctor bride, sitting at home can provide consultations to patients in far-off community, why can't all female doctors do so? And with that concept, I started Sehat Kahani, which is the company I run today. So Sehat means health in Urdu and Kahani means story. So poetically, we are trying to change the way health stories are written in Pakistan. But the mission of the vision of the company is to democratize healthcare access for all using telemedicine, which is virtual consultation, as you can see in the picture as well, and a cohort of previously home-based female doctors. So this is me. Again, I look a little fancy there. And the company is co-founded by me as well as my co-founder, Dr. Ifat. She's also a medical doctor. She and I formed this company together because as I had gone through the Dr. Bright phenomena, she had gone through a very similar phenomena in her life in which she was working post her graduation as a medical doctor in a pharmaceutical company. And that pharmaceutical company had stairs and no lift. And she had to climb 4 floors to reach to her office. And she also became pregnant. And she lost her baby in a premature birth. So she was 6 months pregnant. Unfortunately, the movement stopped and the baby died. Everyone, right from her relatives to her mother, to her husband, to every living being around her, told her that you lost the baby because you were working and you climbed 4 flights of stairs. So next time when she conceived, she got so scared by the stigma that was induced on her by society that she left her job and did not continue with her career until her daughter was 8 months. So I actually met her when her daughter was 8 months. And my daughter was, I met her when her daughter was 1 year and my daughter was also 1 year. And she completely resonated with the idea because she had gone through something very similar that I had. So we connected on this and we started the company together. And if I just quote some stats, just to bring you up to the significance or the magnitude of the problem that we work with, is that Pakistan has a total medical workforce of 200,000 doctors. 63% or more are female doctors. So females are clearly majority in Pakistan. However, due to socio-cultural pressures, and as I explained, the doctor bride phenomena, only 85,000 or more of these doctors don't work. So in Pakistan, the doctor-patient ratio should be 1 over 1,000 people because we're a country of 200 million people with the 5th largest population in the world. But because 85,000 doctors, the majority of the medical workforce, because they don't work, and a lot of male doctors leave the country for better work opportunities, we are left with 1 doctor for 1,700 people, which is way below the minimum WHO standard. what it does for a country like Pakistan. So it makes Pakistan 154th out of 195 countries in terms of accessibility to healthcare. They have the highest rate of breast cancer, again, goes completely ignored. They're the second worst country in the world for newborns to be born. Obviously, when healthcare is not available, women and children are disproportionately affected. A woman dies every 37 minutes in pregnancy in Pakistan. 40% children have stunted growth, so that they're not growing the way they are. And family planning is negligible. So we have extremely high 3.6 fertility rate, which means that we're going to double by 2050. So we're 200 million right now, and we're going to get to 400 million. And imagine we're not solving the doctor bride phenomena. So we're going to have even worse doctor-patient ratios. But what we realize that although there are many health challenges in Pakistan, one of the massive opportunities that is knocking on the door is Pakistan's telecommunication boom. So Pakistan has around 40% internet penetration, which is extremely good for a third world country. It's completely ironic that half of our population, 100 million people, don't have access to qualified doctors, but half of the population has access to smartphones. And telecommunication industry in Pakistan is also booming and has significantly contributed to exports. If you see globally as well, especially after 2020, telemedicine industry has massively expanded after COVID. So it's a $202.8 billion industry now, billion-dollar industry by 2027, and it's growing at a rate of 18.5%, which is massive for any. So keeping that in mind, that we have a cohort of female doctors who couldn't work, we have a population of patients who cannot reach doctors, and we have a massive telecommunication advantage, we created Sehat Kahani. And what Sehat Kahani does is we connect female doctors from their homes to patients who need healthcare using a chat audio video enabled telemedicine solution that connects female doctors to patients virtually on a chat audio video call. And we do this in 3 ways. So when me and Ifat started, we started with the idea to replicate the pilot that I had done before I started the company. So we started making nurse-enabled telemedicine clinics in low-income communities of Pakistan. These are physical spaces where nurses are sitting, we train them, we upgrade the infrastructure of the clinic, we make it a nice, presentable primary healthcare center. So then when a patient walks into the clinic, they get greeted by a nurse, the nurse takes their history and examination, and then they get connected to an online doctor. However, as we transition through many years of the organization, we realize that clinics have a limited community that they can serve. And in every clinic, we can place 2 to 3 doctors. So we're really not changing anything for the 85,000 doctors who are sitting idle. By this time, telecommunication was also booming in Pakistan. So in 2018, we started working on a mobile application. This mobile application is focused on smartphone users, and it allows a smartphone user to connect to a patient directly. So in between the 2 models, the clinics run in low-income communities. They are manned by nurses, and the nurse connects the patient to a doctor because it's a low-income patient. They don't have a smartphone. They're not literate. But for smartphone users who are literate, who can navigate apps, we have a direct mobile application as well. And in both our verticals, we have a 24/7 helpline in case a patient cannot reach the clinic or in case the mobile application does not work. So we connect patients to doctors on feature phone or a normal call as well. Within the mobile application, we have further 2 segmentation of patients. So we provide application to everyone, which is a retail user for us. So patients who use the app independently. But then we also provide our application to corporates so that they can take telemedicine coverage for their employees, so that their employees can have access to online doctors as outpatient coverage, or when a corporate employee goes to a doctor, there's no reimbursement by the corporate. So we give a cheap, cost-effective alternative of negligible outpatient coverage in Pakistan through our corporate application. So if I talk about the patient journey between the clinic and the app, so as I said, when a patient walks into a clinic, they're greeted by a nurse. The nurse takes their history and examination, and then the nurse connects the patient to the online doctor. After the consultation, a prescription is generated, which is printed at the clinic. If I talk about the mobile application, Then the patient goes to the mobile application, they find a doctor themselves, they pay for the consultation, or if they're a corporate user, their corporate has paid for them, and then they can connect it to a doctor on video consultation, and then a prescription is generated that can be emailed and messaged to the patient. We knew from day one that we had to become a health impact business. We never wanted to be a non-for-profit. So we have a business model associated with all our verticals. So in the clinic, the patient pays between $1 to $3 for their range of services. For our corporate application, the corporate users are charged on an annual subscription. And for the retail application, the patient can pay through a subscription plan, or they can pay as they use the app per consultation as well. So Sehat Kahani has been in life for the last 5 years now. We have the largest network of telemedicine clinics across Pakistan. So we have 35 clinics across all 4 provinces of the country, ranging from Sindh, Punjab, KP, and Balochistan. We have been able to create the largest network of corporates who use a telemedicine application. So we're servicing 753 corporates today through individual accounts as well as insurance partners. We've done over 500,000 consultations till date. This number is a bit old, my apologies. We've had around 300,000 downloads of our retail app, and overall we cover 7.2 beneficiaries through our clinic, our corporate, and our retail app. We've also managed to create a network of 5,000 female doctors. 81% of these doctors are in Pakistan, 90% are global. These are doctors between GPs, which are general physicians, specialists, and mental wellness experts as well. So why international doctors? Because doctors living in Australia, London, America, they cover for the nighttime hours when Pakistani doctors are sleeping. So it creates a healthy mix within the application. In terms of the disease analysis, as we said, we cover primary care diseases, we cover mental health as an important component as well. We've seen around 8% of our total cases has been for COVID-19. We service to 60% women on the platform and 40% men. And in terms of user satisfaction, we have a 93% user satisfaction rate in using the application. So when COVID came into Pakistan in March 2020, we had been giving services for the last 3 years. So we had the clinics, we had the mobile application. However, there was a lot of resistance in people still. People still found it hard to believe that how a female doctor can provide consultations to patients, how virtual consultations are possible. But when COVID came, because we had the network of clinics and mobile app, we got picked up by the government. And that is when we got a massive boom. So our application was outreached through the government to everyone in COVID-19 lockdown to use as an alternative to physical visits, which enables 75,000 patients to get consultations. We partnered with the government across 5 governments in Pakistan, because in Pakistan, health is devoluted. So we have 5 provinces, 5 governments, to work on an ICU version of the app that allows junior staff in the ICUs to connect to critical care specialists in times of COVID care emergencies, to provide tertiary care advice in ICUs. And now we're integrated in the national platform for telehealth as a telemedicine partner in the second wave. We've also done a lot of work in mental health. So all our clinics provide mental health support, counseling services. We also have 2 helplines that we run with the government. One is a mental health helpline, and the other is a drug abuse helpline, which allows psychiatrists, psychologists to connect to patients to give them advice. And we also are disseminating our application in universities because in Pakistan, schooling has been disrupted in the last 2 years because of COVID. And there's a lot of stress and anxiety found in university students who are unsure about their careers, pushing them into depression, anxiety, stress. And we are providing our app as a solution to talk to a counselor in the absence of a counselor available in their university. If I talk about our corporate partnerships, so we're working with some of the biggest names of corporates in Pakistan. We work with banks, we work with the corporate industry, we work with the pharmaceutical industry, we work with insurance partners as their partners providing online coverage to their corporates. So all in all, we're covering around 7.2 million patients through the corporate partnerships. We have been able to manage big partnerships with insurance providers. So Jubilee is one example. Jubilee has 2,000 corporations, and we provide online telemedicine coverage to 700 of them, which makes 3.2 million customers just of Jubilee alone. In terms of revenue, we have closed this year at 1.1 million revenue and a net profit of around $500,000. We have around 250 people in the team. 60% of our team consists of community dwellers. We have around 75% female leadership in the company, which makes me really, really proud. And we're really an organization that favors female employment and reintegration back into the workforce. So even if you see here, you'll see a lot of women in key positions, but this is the dream team that I have, all young people, all under 35. And actually, me and my co-founder are the oldest in our team, but it's really a group of dynamic people, of men and women who are trying to change healthcare delivery in Pakistan. In 2020, we also became the first and the only telemedicine female-led, we became the first and only female-led company in Pakistan to raise a pre-series A round. No other female-led company had raised funding before from private equity investors. We are now on our road to raise a Series A, because once you're into it, there's no escape. So we are now trying to raise a Series A round of minimum $5 million that we have to complete by April 2022. And I think what we're really aiming forward in the next 18 months is to do rapid expansion of our clinical, our mobile application vertical, both retail and corporate, but more retail. We are expanding our public-private partnerships with the government. So we are working with a lot of government dispensaries now to convert them into telemedicine clinics, which don't have doctors. We're also expanding our tele-ICU platform across more ICUs across Pakistan. And we're also adding pharmacy delivery into the mix so that patients who come on the platform can get pharmacy or medicines through the platform as well. In terms of our mental health services, we've introduced a mental health chatbot because Pakistan has around 400 psychiatrists and psychologists for 200 million people. It's a massively under-resourced field. So we cannot provide psychiatrists and psychologists to every patient. So in order to reduce doctor-patient consultation time and filter out patients, we've created a COVID-19 chatbot. We rapidly are introducing mental health services on subsidized rate in our clinics, as well as on our corporate and retail application. So now we have an assisted well-being program for corporates as well. But I see the future of the company in the next 5 years is to make a technology that is super easy and friendly for the patient to use. Someone like my mother can use it on a click. So our app is a 2-click operation. So you go in one window and you get connected to a doctor in 2 clicks. We're trying to change it into a 1-click operation. Of course, that uses a lot of machine learning and AI to be able to do that. So we're working with Microsoft on some tools to make sure that the doctor sorting, symptom sorting can become better. We want to introduce 50,000 female doctors back into the workforce. We want to make sure that we take this platform outside Pakistan and other countries where there are similar healthcare issues. So for example, MENA region, Bangladesh, Saudi Arabia is a few countries that we're looking at right now. In terms of technology, because I previously mentioned our work, so just delving deeper into that, we've divided our technology developments over the year into 2 phases. So in phase 1, we are updating our disease surveillance dashboard. So we get a lot of data on the application. Now we're working on solutions where we can regionally tell people that, for example, in Karachi, if we're getting a lot of patients of diarrhea, we can send notification or SMS or alert the authorities. As I said, we already have mental health and COVID-19 chatbots to reduce patient-doctor consultation time and filter patients. We're also updating, so as I said, we're converting from a 2-click to a 1-click operation, improving customer experience. In phase 2, we are updating our data-driven clinical support system. So we already have algorithms that doctors use, but we're updating those algorithms rapidly to introduce more symptoms, more diseases, more complicated diseases, specialist diseases into it, so that clinical information is automated. And we also want to integrate with wearables, particularly blood pressure instruments and glucose instruments that are present at home for self-monitoring of patients as well. So in terms of digital expansion, our first country that we're looking at is Bangladesh, which I think has very similar issues as Pakistan in terms of healthcare, in terms of doctors' deficiency, in terms of patients' access to healthcare. Then we want to expand into the SIA and the MENA regions. We're working with some partners, with some telecoms, with some banks to initiate these partnerships. Sehat Kani has also been very, very privileged to be introduced and distributed through a lot of media agencies who've helped distribute our work. So we got focused on the economics. We've been mentioned in the World Economic Forum series, and that's really helped us. A company from Pakistan, a female company from Pakistan, to establish itself to the global market. So I'll stop here, but I can answer any questions that we have. Thank you for listening.
Hey, Sara, this is even at the second time. It's one of the best presentations I've ever heard. And the story behind is just amazing. Thank you very, very much, Sara. I, of course, do have questions, but I think Andrea has collected the questions from the audience. And Andrea, you may just raise the questions, and then the one who has the questions, and would also be great if you all could switch on your cameras, because I love to see into faces rather than into black screens. So that would be great. So Andrea, would you take over? Okay, Andrea is not here, but I saw...
Hi, Sarah, thank you so much. Got a couple questions coming through from... I am here. Can you hear me?
Yes, yes, I can hear you. Sorry, I was telling my daughter not to come in the room. So that was not for you, that was for her. Yes. I can hear you, please go on.
Okay, I assume she has bad connection.
I think my internet went out.
Yeah, okay, Andrea, if you do have bad connection, I saw questions. One question was coming from Jude, is this right? Could you please unmute yourself and ask your question, Jude? Is the question came from you?
Should I ask the questions that are in the chat first, so that we can get them out of the way?
Sure. Okay, just start with the chat bot. Okay, yeah. So Jewel,
yes.
Could you repeat your question, please?
Yes, hello. Thank you for the presentation. I see you also for the second time, and your story is really amazing, and congratulations.
Thank you.
And my question was, I had two questions. One was about the healthcare system in Pakistan. Is there some insuring system, or I've heard from you that you have corporate clients and self-payments, but what is the system in general? So how could you integrate your services into the system? That was the question.
So thank you, Jules. I think it's a great question. So the system, can you hear me? Am I audible?
Yes.
Okay. So the system in Pakistan is actually from the British system, because we were a colony 70 odd years back. So we have the same sort of NHS system that is principally in place, that patient goes to a basic healthcare unit, a GP sees them, and then they are transferred to a secondary care unit and then to a tertiary care unit. That's the basic system, and it should be a public healthcare system. It is free for the patients to use. The complication arises because Pakistan is massively under-resourced for doctors, nurses, and healthcare professionals. And it's an absolutely blowing population. So what happens is, when patients go to basic health units, there are no doctors, there are no medicines, there's no lab. They go to a secondary care unit, they're negligible doctors, maybe a one meal doctor available. Again, no labs, no pharmacy available. So they eventually all turn up into tertiary care hospitals. Those are in major cities. Those are not in villages and low-income communities. So by the time patient comes to the tertiary care hospital, they've spent money in travel, they've lost their job, maybe because they were sick, and their disease is so advanced that it becomes complicated for patients, for doctors to solve them. Also, the tertiary care hospitals are very exhausted and overcrowded because everyone is coming there and the doctors are overburdened. That's why, because there's a lack of doctors in the system, a lot of quacks, a lot of midwives, a lot of dispensers have taken up that place in low-income communities of doctors. So incidentally, 90% of healthcare in Pakistan today is being done through private providers, through nurses, through doctors, and 10% through public providers or public hospitals, because there is lack of healthcare facilities and lack of healthcare infrastructure. So when a patient pays for a consultation, 88% of time it's out of pocket, that means they're spending themselves, and only 12% of the time they're using government facilities. Which also has a lot of implications economically, because one health incident pushes the entire family into poverty and to a lower economic status, which is what we call the health shock when it comes to an already poor person in Pakistan. In terms of insurance, the insurance market is small, so there are 1.6 million corporate employees in Pakistan. The insurance that is available in Pakistan is usually inpatient insurance. So once you are hospitalized, your corporate will pay for you. But if you go to a doctor in an outpatient visit, when you show to a doctor for a primary care issue, that is generally negligibly reimbursed by any corporate. It's hardly ever done. So we are trying to tackle that market of OPD coverage for corporates. We work with a lot of government initiatives. So I explained, we are working with the government to convert these basic health units, which have no doctors, into telemedicine unit. We're giving our app in ICUs. We're giving our app to community health workers so that they can connect patients to doctors. And in terms of corporate application, we're trying to become this arm of insurance providers as an outpatient coverage alternative.
Very good. Thank you so much, Sarah. I think, Petronella, you do have a couple of questions. Would you take over, Petronella?
Thank you so much, Dr. Sara. That's really inspiring. And I applaud you and your co-founder for being women-led in a very masculine country, achieving this for everyone. Yes, a couple of questions from my side. Maybe I'll start with the first one. What was the greatest challenge you faced when it comes to the adoption, right? You're dealing with a double-sided marketplace, patients and doctors. And how did you deal with that, with the adoption factor? And then I'll ask my second question.
Sure. So I think when we started with the low-income market. And I remember when we made the initial clinics, we used to get 5 patients, 6 patients a month. That has now changed to 1,000 patients a month in majority of our clinics. What changed? So we slowly learned the art of how to convince people on how a virtual consultation can be comparable to a physical consultation. And that you can do with a simple thing. When a patient comes to a doctor, they want to tell about their issues, but they really want the doctor to listen. And that is what has helped us. So the average doctor-patient consultation time in Pakistan is around 120 seconds. That's how long a doctor spends with a patient on average. On our app, the average is 18 minutes. So what created adoption in the long run is what doctor listening to the patient, showing empathy, showing concern, giving them time, taking a proper history, asking the nurse to do a good examination, and really helping patients come out of their medical issues. So that, I think, over time, whether it was our clinic or whether it was an app, this was an overlaying strategy that worked everywhere. In the clinic, especially, the nurse who was the champion really changed the game for us, because wherever we had a good nurse champion, patients converted more. But generally, I think once we got the patient on the screen, it was how the doctor and the patient talked to each other and how much rapport they were able to build, because that only happens when you spend time with the patient. I think it's a global phenomenon. It's not just in Pakistan. In terms of your second question, that what is the value proposition for doctors to join the platform? I think we're catering to a community of doctors who don't work after marriage. So they are not working and they've studied for something for the last 15 to 20 years of their life. So it takes a toll on their mental health. They lose self-esteem, they lose self-worth. And when they come on the platform, they get the following things. They're able to earn money because they get a percentage of each consultation. They're able to choose a time that they're comfortable to work in. So there's flexibility in days and hours. And they are able to get cover. So if I cannot work today, I'll ask my fellow female doctor to cover. Because in our company, a parent-teacher meeting for a mother is an emergency. So there are no eyebrows raised when a woman has to be, a female doctor cannot come because she has to go to school or she has to attend to a sick child. So they get to be part of the community. They get to be a part of a cohort. They get flexibility. And also it remains within the cultural and social boundaries. So they're not getting out of the house. So their husbands are happy, their in-laws are happy, and they're getting a fair opportunity to get back into the workforce and work for patients and do what they're doing. So it is a win-win situation for everyone.
Thank you so much for this extensive answers. Just a follow-up question on this value proposition for the doctors. You, in your presentation, you mentioned that you're also connecting globally with doctors from Canada, Australia, and so on. Are all these doctors from a Pakistani descent that follow the same type of cultural aspects, or are they also doctors from a different cultural background?
I'm sorry, your voice cut. I missed the question. Can you repeat the question?
Sure. In following up on the value proposition of the doctors, it's clear how it works in Pakistan. In your presentation, you've mentioned that you were building also a community of doctors across the world, Canada, Australia, you mentioned, and so on. Are these all doctors who come from Pakistan or follow the same type of culture aspects, or are they also from other culture background that are part of your platform, and they serve, let's say, patients in Pakistan, or they serve patients, let's say, in Australia?
So that's a very good question. Thank you very much. So all of them are Pakistani doctors, because in Pakistan, if you need to practice, you need to have a Pakistani license. So other doctors from other countries cannot work in Pakistan unless they have a Pakistani license. So they're all Pakistani doctors, but 8% of our consultations happen outside Pakistan for an international audience. It's generally the Pakistani diaspora outside Pakistan who settled and cannot access doctors because of access issues, against insurance issues, refugee issues, etc. So we cater to international audience as well. That is generally from the Pakistani diaspora.
Sara, thank you very much. I also have a question. How do you acquire your female doctors? When you started, how long did it take you to raise? Because it feels like an amazing race. For 5 years, you have 5,000 female doctors on board. How did you do this?
So initially, I think, because there's so many in abundance. We started with like 2 doctors, and then quickly a lot of doctors joined in. Since 2019, we have been having a good inflow of doctors, especially in COVID. A lot of doctors joined because they saw an alternative opportunity to work. So building a supply chain wasn't a problem. We reached them through SMS marketing, through social media pages. So much so that we opened the registrations on the application 2 months ago, and we got 6,000 applicants in 5 days. And we had to close the portal because it was crashing down. There's so many female doctors who are applying because they're all over the world and they want to work and they want to earn money, because money gives you financial independence. Financial independence gives you social independence. Yeah, it's all connected, right? So we haven't had an issue in building the supply chain. Yes, we obviously have to build a demand to get them enough patients. So that's what we're doing.
Okay, no, it's absolutely amazing what you're saying, that within no time you had 6,000 applications. That tells a lot about how important it is to work. And I have another absolutely stupid question. So assuming I'm a Pakistan licensed doctor and I would like to join the platform, which devices do I need to do this besides a stable internet?
Yeah, we do give an internet device and a mobile phone to the doctors now. We've just started doing that. But previously, you just needed a laptop or a mobile phone and a valid internet connection. But now to all the doctors, we have this gift pack. When you start on the platform, we do provide phones and a tripod stand and an internet device for them to do consultations.
And how do they then communicate? Do they communicate via a Zoom-like portal, or how is it? What is the application there?
So it's our own application. It's not Zoom. The patient comes to the app, connects to a doctor, and then they enter into a session with the doctor. It starts with a chat consultation, and then they can convert into an audio or video consultation.
Okay, super. Okay, there is another question from Petra. Is that right? Yeah.
Yeah, thank you so much. Just following up on Petra's question. Here in Europe and the US and that we have lots of discussions around privacy issues and security. How do you ensure that your platform is more or less bulletproof for security and privacy issues? I know that maybe things in other countries are different, but here in Europe, there are lots of challenges when we, you know, that startups in the medical field need to comply with, and not sure what's the situation over there in Pakistan, and what can we learn from you to make it a success?
So see, I think consent is very important when it comes to healthcare first and foremost. So we do make sure it's in the term and conditions, but a lot of patients don't read terms and conditions in Pakistan, to be very honest, and they just click on that button. So before a consultation starts, we take consent from the patient for the consultation, and then we also tell them that this is not an alternative for a physical consultation, and if they feel the need, they should be going to a physical doctor, and the doctor will tell them. So that's where the patient's privacy issues concerned. In terms of the privacy and security of the application, we use extremely well-managed HIPAA compliant Microsoft servers. The access of the application is only with the super admin, with no visibility to anyone else. We use an organization in Pakistan called Virilius that works with early stage companies to do firewalling and proofing of the platform so that it's not breachable, because we've had some data breaches even with big organizations. So they put security checks in place to make sure that the data is encrypted and replicated across different containers in case there is a breach, God forbid, or data gets lost or the servers got down. We have multiple copies available of the data in different containers according to my Microsoft MySQL containers so that we can retrieve the data quickly as well. So we do make sure that it's completely safe and secure for the patient to use. And we don't share our data with any third-party organization for medical purposes or research as well. So we're very, even the corporates cannot see any data of their patients, and we contain complete anonymity on the platform.
No, that's very important. Sara, I have another question. You mentioned in the beginning that your co-founder lost her baby when she was 6 months pregnant, and because she had to go to work and she had to, there were five, what do you say, five stairs or whatever, 5 floors, and she was blamed for having worked as a woman. And you were speaking about this stigma. Now you're working at home, you're working from home. These women are now working from home. Is that more appreciated by the in-laws and the society in Pakistan? Is there a change, a mindset change, because they are now at home?
Yes, absolutely. I think when a woman is working from home, see, there are 2 problems. One is the cultural boundary. A woman stepping out of the house from Pakistan is still considered, is still looked down upon, because she's leaving her house, she's leaving her children. So when a woman works from home and the children are around and she's not crossing any cultural boundaries, that is appreciated, or at least, well, it's better managed and better tolerated is the right word to use. So yes, I do believe that women working from home have an opportunity to be better.
Okay. Very good. I see there's also a question from Celine. She's asking about marketing strategy to reach your patients. Where's Celine? Can you take over, Celine?
Yes, thank you. Many thanks, Sara. Very interesting. I guess one of huge challenge you have faced is to reach the Pakistan patient. So which strategies, marketing strategies did you choose to inform that your service exists and is useful for the population? How did you do?
So our biggest challenge was working in the communities, because that is where the massive resistance is, because they're non-literate. They think when we first started using telemedicine, they thought we were going to make videos of them and deliver it to the dark web or something. Those were the kind of issues we had to face. So I think what changed was having a good community champion. We had a female mobilizer who went door to door and also did in clinic sessions for health education and promotion. So giving the community a message that we're not just here to earn money and give you a doctor, but we're also interested in your health in a wholesome way. We do a lot of SMS campaigns in the community as well, taking data from the telecoms. We also do cable ads in the communities. We do a lot of banner placements. So that's how we reach out to the religious leaders, we reach out to the school teachers. So that's how we do community mobilization. We do health camps in the communities, and that's how we get patients in. In the corporate organization, we built a sales team who pitched the application to the corporate. And literally in the corporates, I think it was a snowball effect in which one corporate liked the service, they took it. You know, the CEO of that organization played golf with another CEO of the organization and he recommended us. One CEO was sitting on a board of the other organization, he recommended us. So it literally happened in a snowball effect when multiple organizations started reaching us because they didn't have a cheap alternative. The challenge that we are now working on is to how to increase penetration of the retail application because digital marketing is an expensive proposition. So now we are investing after a raise into digital marketing, Google ads, Facebook ads, YouTube ads, so that more people can see our application when they use digital media, and they can download the app and use it.
Thank you.
I see another question from Jewel. She was asking, but I think you already answered that, Sara. Did you develop your own clinic information system? You answered this question. Yes, you did this. Yeah. I am just wondering. So at the moment, to get it right, you have a good proportion between patients and doctors. Is that right? So you're either looking for new patients than for new doctors. Is that right?
We are looking for patients. Yes, we're looking for. We are trying to penetrate in the market as quickly as possible so that we can keep delivering the services to as many patients as possible.
Yeah, no, it's really absolutely impressive, and I think the markets you are looking at who have a similar structure than Pakistan, it's also a very, very good idea to develop your business any further. So I think it's really super interesting. I have a question to the community. Is there any other question for Sara?
I have one.
Yes, please go ahead, Julie.
Hello, Sara. Thank you for your presentation and determination, which are quite inspiring.
Thank you.
I have a question about your competitors and why and how you convince patients to choose you and to choose only female doctors.
So we have competition in Pakistan. There are 2 or 3 applications that are working in telemedicine, but they only cover the retail aspect of the work that we do. There's no other telemedicine organization that works for a low-income community through clinics for corporate and retail users. So we have the first mover advantage. We are very, very focused on creating a female doctor leadership, female doctor workplace in the company, because I think my main motivation and my passion comes through that. You know, I am motivated and challenged by the idea that I need to bring back female doctors back into the workforce. It's not just another telemedicine organization that is helping patients, but it's also creating a dual solution for the supply chain as well. So that's why we keep focused on female doctors. However, for certain issues in Pakistan for which female doctors are either not available or it becomes too uncomfortable for patients and doctors to talk to each other, for example, sex, genital issues, urinary issues, psychological issues. For those issues, we do have male doctors available on the platform, very few in number, but they are available on appointment basis if a male patient feels more comfortable.
All right. Thank you.
Go ahead, Petronella.
Just talking about patients and finding more patients. What about if I were interested in talking with a doctor? Let's say I'm a patient here from Switzerland and I'm interested in talking with a doctor in Pakistan, let's say a female patient, or in other countries, you know, they are pretty sure there are women from around the world who would love to talk and be part of the platform, even with the Pakistani doctors.
Yes, you can absolutely use the app from anywhere in the world. However, that's organic growth. So you've heard about me and you'll use the app maybe because you've listened to me, but we're not focusing. We have to focus on countries to be able to really disseminate operations there. So yes, any patient can reach out to us, but we are focusing on certain countries for growth, which for us makes more sense is to go into the MENA region and to Bangladesh, because they're primarily Muslim organized Muslim countries. So the religious factor is taken care of. Culturally, they have the similar cultures of conservativeness. So female doctors there might have these issues. And then there's a doctor access issue as well. So we are doing a stage-wise expansion outside Pakistan into countries that make more sense for us. But absolutely, it's usable all over the world.
Yeah, I'm asking this question because I know somebody in Canada and she's from Pakistan and she's Muslim. And she said that in Canada it's quite difficult to find this kind of doctors who respect the religious aspect of a person. So maybe I will refer her to your platform, even if she's in Canada. I mean, she can leverage the power of your platform.
Yes, she can. And a lot of Canadian patients use our app because there's a big Pakistani community in Canada. So they can definitely use the application.
Fantastic. Thank you.
Sara, thank you very, very much. I have one last question for you because I think that's really absolutely smart. So you did not only invent the app to do the exchange with mobile users, you also went into the hospitals. So my question, was it all done at the same time? Or what was the reason? Because I think this is really USP for you and your company, because you have the hospital patient relationship plus the mobile relationship. When did you start with the hospital? Was that the first one or was the app?
So the clinics were the first vertical, but these are primary care clinics. So I wouldn't call them hospitals. These are primary care clinics. So the clinics came first and then the mobile application.
Okay, so that's really, so you have a very stable background there. So if there is no more question, I think it's Sara, we will for sure invite you. This is so motivating what you are saying, and also it's so impressive what you have done in this short time. And I would like to thank you very, very much for running this absolutely wonderful masterclass today. And for everyone else who would like to listen to her and to her co-founder, we will have another session with Sara at the Davos Digital Forum on the 23rd of September. I'll let you know. And Sara, it was really absolutely amazing. I think it's shortly before 8 o'clock. You have to go to bring your daughters to bed, or how your husband has done that already, and go for dinner. Thank you very, very much, Sara, and everyone else. Thank you for joining. And having said that, Sara, you are a star.
Thank you. Thank you so much, Petra. It's always a pleasure. And thank you so much for having me here, for promoting, for supporting. And it was a pleasure meeting you and all the lovely ladies, and very nice questions. So thank you for giving me such an attentive audience. It's always a pleasure. Thank you. Good night, everyone. Good night.
Bye-bye.
Thank you.
Bye-bye.
Bye.
Bye-bye.
Bye.